do it.
All right. Well, I am here with Dr. Ben Depass. He's one of our awesome chiropractors at Rhodes Chiropractic here. And my goal here is basically get to know you. So I wanted to interview Dr. Depass and create a podcast for our audience to get to know you and for new patients. So I think there's a lot of cool things people might not know about you, like you're fluent in French.
Yeah.
That's how you got your girlfriend, right?
Exactly.
No. And you like to cook and a lot of cool things like that. But you've been a chiropractor here for about a half a year at Rhodes Chiropractic. And I know you're a graduate from Western States, originally from Canada. But why don't you introduce yourself? Give us a little bit about your background, where you're from, a little bit about your family and how you got here.
Yeah, absolutely. I come from a small little town in Canada, Ontario, Southern Ontario, Chatham, Ontario. I grew up there most of my life. And then I eventually did my undergrad at University of Ottawa, where I did Human Kinetics in French.
The whole thing in French.
Yes, the whole thing in French.
Wow.
Yeah. They had a good, grant. So it was
Okay.
kind of pushed me towards.
Yeah,
I did
that's great.
high school and elementary school all in French, especially because in Canada, it's the two official languages.
Unless you're West Coast, then
Oh yeah, no one speaks French.
yeah.
Mainly, and especially because University of Ottawa is a 10-minute drive from Quebec.
Okay.
So it's very, very close there. And being
Got
the
it.
capital of Canada, it helps as well.
Right.
Yeah.
That's awesome.
Mhm.
So give us a little background into, what got you interested in medicine to begin with. Was it your dad? Was it sports?
I would say it's a mixture of all of it. Early in life, I do come from a family heavily in the healthcare field. My dad is a retired general surgeon. Two of my sisters are nurses. A third is a physiotherapist, and a fourth, she deals with rehabilitating the elderly. And then my stepmother is also a diabetes educator and used to be a nurse as well.
Okay. Wow.
Yeah.
Definitely health-oriented family.
Exactly.
Okay.
Big shoes to fill. But
Yeah. That's awesome.
yeah, it was great, and it was a great area to be in. Great leadership as well. Growing up with it, learning about the healthcare field, learning what I would like and what I wouldn't like.
Sure.
Originally, when I finished my undergrad degree, my father was pushing me to do nursing
Okay.
because, especially being a male, it had been guaranteed employment.
Okay.
But then after hearing the stories from my sisters and my stepmom,
They pushed you away.
they pushed me away.
Wow.
Yeah,
Okay.
definitely not the field I wanted to get into.
Got it.
Yeah.
Okay.
And so then I was after I finished my undergrad, I was kind of trying to figure out what I wanted to do. A lot of people, they go into physiotherapy there. It's a 2-year master degree.
What was the name of the degree again that you got in undergrad?
It's a honors and bachelor's of science in human kinetics.
Okay.
In French.
Okay. Which that can lead to PT, chiro,
Exactly.
kind of pre-med track.
Exactly. And that's
Okay.
yeah. It's unfortunate because it's not a degree that will get you a guaranteed job, kind of like engineering or anything.
It's a stepping stone to a higher degree.
Exactly.
Okay.
Exactly. And so I originally tried for physiotherapy in Canada, and I guess I didn't get in first
Okay.
attempt. So what I was doing is I was retaking courses, and I started shadowing some physiotherapists, and it's different from the physical therapist in the States. That's not a doctorate, just a master's. And so I just kind of saw what they did, and it wasn't really exactly what I wanted to do.
Yeah.
It didn't seem like you could make the big decisions, and I wanted to be my own boss. Wanted to make
Yep.
my own, like I said, decisions.
Yeah.
So then I went and actually
And not need the referrals and
Exactly.
you're more of a portal of entry physician now
exactly,
where someone can just come see you and you can guide their care however you want
absolutely,
and not be
absolutely.
controlled by a, government system or hospital system. And
Exactly. And so what I actually did is a friend recommended, what about chiropractic? And believe it or not, I thought chiropractic was a hoax.
they're quacks.
The quacks, witchcraft, all that fun stuff. But then I went and I shadowed 2 young docs, Dr. Isaiah Redfern and Dr. David Maringer, and they kind of opened my eyes to it. They went to, both Canadian as well, but they went to NYCC. I think it's now Northeast Chiropractic
Yeah.
or something.
Okay.
And they kind of just opened my eyes to it. Redfern focuses more on neurology side of things, dealing with concussions, migraines, vertigos. Whereas Dr. Maringer, he focused more on the musculoskeletal system, getting people feeling better that way. And so viewing the two different worlds and showing me that, it's not just crack 'em and rack 'em as
Right.
people think.
Right.
They show that chiropractic, as well as similar to my undergrad, is more of a stepping stone. It gets you in the door to figure out what kind of specialty you want to go into if you do want to specialize.
Mm-hmm.
And that really drew me in because it's kind of like, I feel chiropractors are very Swiss Army knives because we can go into many different branches and take from other individuals and other professions and add into ours, make it very, efficient. Get in there, get out. And so after that, I just started shadowing them more, seeing what they do. And then after that, I just started applying for chiropractic college.
That's awesome.
Yeah.
Yeah. I think that's more and more common path for a lot of students, like not knowing what chiropractic maybe even is, and then exploring it, or maybe they've had success with it, just never thought it would be something they would do. But I'm a believer everything happens for a reason. And, here you are now, an amazing chiropractor, getting great results, and, it all worked out.
It'll make me blush. We keep saying,
yeah. Well, that's awesome. Let me see what other questions I have for you. So that's your journey to chiropractic school. Here's a question I have for you. Is there anything that was kind of surprising that you learned during chiropractic school?
I feel the thing that was very surprising when I went into it and started chiropractic college was just the scope that, especially here in Oregon, the scope of practice is so wide, especially with more training, and we can do minor surgery, obstetrics, the list goes on. And I felt that's great because you're not stuck into one position. After a few years of doing the same thing, you can switch and do something else.
Right.
And so, we also learn how to do abdominal exams, lung exams, and it comes in handy. There's multiple times I have patients come in, they're sick, they're not feeling well. They've done the Zoom care virtually, and they said, I still feel terrible. And I said, well, did anyone listen to your lungs? And they say, no. So I said, do you mind if I listen to your lungs? And you can hear the crackling, listen to it, you hear the crackling. You say, yeah, you need to go in person and because most likely you have pneumonia or something.
Yeah.
Going on. And patient comes back and they're like, you were right. It helped. I went and got some medication. Yeah. Feeling better. So I feel like with chiropractic, it helps us because we're taught how to pick up all these different things and put it into practice.
Yeah. Yeah. I would say I was pretty surprised too at the depth and knowledge. And I think the public thinks it's like a 1-year course or weekend course. Like it's pretty intense, maybe it's not the level of a surgeon or something, but it's 8 years of college, 7-8 years in total. So for our audience, what would you say describes your approach or philosophy when it comes to patient care? What could a new patient kind of expect your approach to be, if they came in?
I would say there's 3 things I mainly target is when the person comes in is I target the root cause of their problem. And that's usually based off evidence. And, we're going to do these certain orthopedics, and if they're positive, it's most likely dysdiagnosis. And then I like to get rid of their pain. And the way doing that is with chiropractic adjustments, but not only just chiropractic adjustments, introducing also functional range conditioning, pin and stretch, other different techniques and modalities to help them feel better. And then the last thing is I would say, give the patient independence. Because my approach is I don't want them to be dependent on anyone.
Right.
I love that they come in, love seeing the patients, but there has to be a certain time where they need to go out and do what they love to do. And I feel like that's our goal, is to get them doing what they love or back doing what they love, and then give them the tools, either giving them exercises or stretches that keeps them from having to come back and see us. I don't think that a person should be coming, once a week for the next 40 years.
Sure.
I always tell my patients, come and see me if something flares up and you know what it is.
Yeah.
But if you're able to fix it yourself with the tools we've given, perfect.
Right. That's awesome. I think that's a great approach. And I know a lot of our patients appreciate that, especially with our capability of taking x-rays. Sometimes we can really see what is the root cause of their issue, whether it's reverse neck curve, scoliosis, PJD, degeneration. What types of conditions or issues do you see most often? What are the most common conditions that you're treating?
That's a good question. I think it's all over the spectrum. I feel like right now I do have a lot of patients with scoliosis, pretty severe scoliosis, over over the 15 degrees, textbook says.
Yeah.
And dealing with that. And I would say also a lot of people with nerve root irritation, a lot of
Okay.
people that have been in previous motor vehicle accidents that still have residual pain. So that pain in the neck going down between the shoulder blades that doesn't seem to go away, whether they massage or with other previous chiropractic, just doesn't want to go away. So I think I see a lot of that, or a lot of what people say sciatica, but usually it's coming from the low back going into the legs.
Right. And you, just for maybe somebody that's never seen a chiropractor, you can get good results with that kind of stuff.
Absolutely. Absolutely. I always tell my patients, I'm going to try my best to get you feeling better. It's more of a humble confidence. I'm going to try my best to get you feeling better. And if I can't, I'll find you someone who can. Because there's always going to be that one patient where no matter what you do, they're not going to get better. So you need to give them to someone like Dr. Ho, for instance,
right,
or someone else who is more specialized in that field, who can give the patient the relief they need.
Right. And you're actually teaching a course, kind of Chiropractic 101 this weekend.
Yes. Yeah. On Saturday.
Yeah. That's awesome. So kind of going off that subject, what advice would you give for someone that's nervous about getting their first adjustment, nervous about coming in to see a chiropractor? A lot of people just have never seen a chiropractor in their life. So maybe for somebody listening to this, that one of your patients sent them this podcast, like, hey, he's not as scary as what you think. Chiropractic isn't as scary as what you think. What would you say about that?
I would say it's normal to be nervous. You're doing something different, something you haven't tried before.
Right.
You always hear the bad stories on the internet about chiropractic, but it's safer than if you take long-term Tylenol.
Right.
Or
there's a risk to everything.
There's a risk to everything.
Ibuprofen, Tylenol. Yeah.
And I feel what I tell my patients is going into it, I'm not going to do anything you don't want to do. And so even when I'm setting up the adjustment, I say, this is what we're going to do. I explain what's going to happen. If at any point you don't feel comfortable, we don't have to do it.
Yeah.
Because there's also other techniques that we can do. Kind of, I was just saying, we're a Swiss Army knife.
Yeah.
It's not just adjustments that we're good at. We can do ART or massage or
shockwave.
Shockwave, anything that could get you feeling better. Because especially I have a lot of patients with the neck. Comes to them,
right?
They get very nervous with
it.
That's
common.
Exactly. But there's other tools. We have the ArthroStim activator.
We can get gentler way.
Exactly, and we can build up to it.
Right.
So we don't have to jump 10 off the 10-foot diving board. Start at 3 foot.
Right. And there's, would you say, many times on the first visit, it's more of just gathering information, so if you can help them. So many times on that first evaluation, there's really no treatment. It's more of really getting the clinical information you need to make that decision.
Absolutely. Because you're basically, I like to joke about it, you're like a detective. You're trying to figure out with the clues that they're giving you what's going on. And it's great that our clinic also has diagnostic x-rays, because we're underneath the tissues. So what's going on with the spine. I had it multiple times where a patient comes in and they only turn their neck about 20 degrees each way. Oh, what's going on? You take an x-ray and you see the full scoliosis.
Right.
All right. Well,
right. That's why.
Because in school you learn that you just keep adjusting and try.
Yeah.
And you take x-ray at the
it's not working out. Yeah.
Exactly. But now you see the x-ray and you say, okay, well, we're not going to get much movement there. Let's try something else.
Right. Right. So, yeah. I've had a lot of patients come in and say, yeah, no one could get my neck. And then, oh, well, that's because you're fused up. So it's great information to know. Let's see here. You basically answered this before, but the question I had for you was, do you work with other types of healthcare providers? How do you collaborate with them? Some people might be working with a PT or their MD. Do you work with other providers like that?
Yeah, absolutely. I think it's great. Everyone needs to know their strengths and weaknesses. Given what we have at this clinic, we can't do all the stuff a PT can. So we work with PTs in order to let that happen. I also have a few patients that come in with dealing with POTS and dysautonomia, so postural orthostatic tachycardia. I've referred them to my old mentor, Dr. Emily Kaler and Dr. Bill Moreau.
They're in Vancouver.
They're in Vancouver, yeah. They specialize in that.
Right.
Obviously, I can pick up that the person has the symptoms.
Yeah.
But I can't treat it here.
Right.
So then, like I had said earlier, give them to the person who can help them.
Right.
And then we also have people like Dr. Ho and Dr. Sales that can help with those more difficult cases that we're able to resolve ourselves.
Yeah. No, that's fantastic. I think that adds a lot of reassurance for patients, that are working with other providers. And many times we see them in conjunction at the same time. I kind of skipped this, but can you talk a little bit about your sports background? You played rugby too, right?
Yeah.
You played rugby. And then also, you weightlift many times a week. So I think that's important for, potentially new patients that, might be listening to this, that, hey, you understand the body mechanics, weightlifting injuries, things like that. Can you just kind of hit on that?
Yeah, I would say
about your rugby experience, that, and then the weightlifting that you do. And
for sure. Yeah, it really comes back in undergrad, we had to do a internship. And I did it with a great guy, Joey Kwasniewski, who was the senior performance coach or the organizer for the whole strength conditioning program with NU Ottawa. So it started there. I learned a lot from him. He's a tough guy, but you learn a lot. It was great.
The hardest teachers you learn the most from, even though you might despise them in the moment.
Exactly. And we'd always have our workouts and he'd be pushing us, and it was great. And so in that, I was able to learn a lot of different sports. So I worked with the men's hockey team, women's soccer, ringette, football was another one, swimming, bunch of different sports, and what each sport demanded of their athletes.
Right.
And creating programs for that as well, and how each one is different. Where football, you need the speed and the strength.
Sure.
Whereas with swimming, you may be more of that endurance. What it is. And so then after that, I actually took a course, and it was about rugby 101.
Okay.
This is in my third or fourth year. And I said, oh, I like this rugby thing. So then I went and I played with a local Ottawa team, club team, played with them for a summer. And then I went on to play with the University of Ottawa rugby.
Wow. Okay.
Yeah. And then, so that was great. It really opened up my eyes to the demands of an athlete.
Yeah.
Each athlete.
Right.
It's different from what you're usually doing. Waking up early, going to the lifts, pushing yourself, being tired. And then eventually, I had to close the book on that. Graduated.
Sure.
And then I just kind of continued on with the strength training that I learned through my studies, and also collaborating with some of my friends as well, because they're also chiropractors and weightlifting as well, and just building on from there and trying to just improve myself as I go along. Yeah.
I think that's fantastic. And with patients that, hey, they're doing CrossFit or weightlifting, or they're in the gym and they have injuries, you can relate. That's something that you do on a weekly basis.
Absolutely.
So let's maybe last couple minutes here, if there's anything else you want to throw in there. But a couple more questions I had here was, where do you see the future of chiropractic care going in the next 5 to 10 years? You see, more people using it, less? Where else do you see the profession going?
I think that's a great question. I think chiropractic, and I hope in the next 5 to 10 years, is getting more and more popular, and that people are seeing the benefit from it, and the stigma around it disappears slowly.
Yeah.
Surely. I think that it's great. The University of Pittsburgh, UPitt, they actually have a chiropractic program. And I think that's a great stepping stone that shows that even a well-established university such as UPitt believes in chiropractic enough to have its own program.
Right.
And so I think all we need to do is just keep growing the chiropractic, keep getting the word out, keep helping people with what we do.
Yeah.
And show that this is an alternative. I feel like a lot of people, they want to jump to surgery right away.
Right.
But I'm big into, let's try conservative care first.
Mm-hmm.
If you get improvement, let's keep going.
Right.
Because you don't know if surgery is going to fix it.
Right.
Oh, so there's people who do need surgery,
but
it's not always 100%.
So really, it should be used as one of the first line of defenses as far as seeing if you can resolve this issue.
Absolutely. Absolutely. Because a lot of people, they think, I've had this pain for 5 years now. It's not going away. I've seen you for 3 weeks and it's still not better. Well, you've been in this pain for 5 years.
Yeah.
It's not an overnight fix.
Right.
It took you 5 years to get into this position. It's going to take a little longer, or 5 years, but it's going to take a while to get you out of it conservatively.
Yep.
So I think a lot of people just need to be a little bit more patient with it. Not quick to the jump, because something my dad always says, it's got to be quick, easy, and looks good. And I feel like it is true, because people want changes now.
Right.
They don't want to have to wait. So I think the big thing is just trying to teach people to be patient, take their time, and just continue what we do, keep helping people.
Right. But if that means avoiding surgery, and even a lot of those solutions aren't permanent sometimes.
Mhm.
So I definitely agree with you that it should be, PT, chiro, those conservative measures should be their first line of defense and then work up from there. And yeah, I also agree the profession is growing a lot. And like you said, a lot of our older patients are like, oh, you should have, seen how chiro was when I was growing up. We thought you guys were crazy. And now it's, especially in the Portland, Oregon area, it's mainstream.
Mhm.
Like almost everybody, if I just walked up to 100 people, do you have a chiro? It'd be easily over 50%.
Absolutely.
And everybody's like, oh, who's your chiro? So especially in this area, that's really more of a wellness community. But I would also, and maybe you let me know your thoughts. Some people think it's like a luxury treatment.
Mhm.
And like, oh, well, I've had people be like, oh, I just didn't even know, like my insurance covered this and I could go in and get x-rays and it was this in depth. I thought it was like a step above a massage or something. And they think like spa, it's like a luxury item when it really isn't.
No, absolutely. Especially coming from Canada, learning about the insurance and, as you've been teaching me how to do the billing and everything like that, how so many people do have insurance and how there's so many benefits with it. A lot of people, they don't even know that they have massage or chiropractic covered, or if they just need to do a small copay.
Right.
So it's not a luxury at all. It's most people do have it. And especially at this clinic, we take almost all insurances, which is great. And it's a lot of people, they're surprised. Oh, it's only that much?
Mm-hmm.
Oh, yeah, absolutely.
Yeah.
Come on in. And then it kind of just shows people that this is chiropractic for everyone.
Yeah. So just to end here, you are accepting new patients.
Yes, sir.
All right. And if anybody wants to book a new patient appointment with you, they can, look up Rhodes Chiropractic, read your profile. We're going to have this podcast under your profile as well if they want to learn about you. And any final thoughts you want to add?
Not at this time. I think just if you haven't tried chiropractic before, come on down, check us out. It's not that scary.
Yeah, no, I agree. Yeah, you're a very easy person to work with. Patients love you. I've seen the results, and it's easy to see someone come in nervous, and then on their fifth visit, they're skipping, whistling, out of here, feeling great. Yeah. So, well, thanks. I know you're busy, you're slammed today, and I kind of pulled you in for this. So, thanks for coming on. And
having me.
Yeah.
Awesome.
All right, we'll call it a day. Thanks, Dr. Depass.